So my two professional goals, 2 years post-graduation, are to pass the NCLEX and start a job with Duke either in labor and delivery or mother-baby. Obviously, we haven't had our L&D mother-baby rotation yet, so that might change by next semester, but right now, that's where I'm at. And then in 3 to 5 years post-graduation, I hope to have found a unit where work doesn't feel like work every day. I want to be able to enjoy my patients, but also my leadership, my coworkers, and even like the physical location of the clinic. And I also hope to have at least begun the process of becoming a certified nurse midwife. The process entails completing a master's in nursing with a focus on midwifery and then taking the certification exam. The master's program is like 2 to 3 years depending on whether you're doing it full-time or part-time. And then after you pass that, you're considered an advanced practice nurse, and the role is to provide primary care throughout the lifespan, providing family care, prenatal care, assisting with labor and delivery, and then postnatal care as well. And then for me, I want to work in an outpatient, like OBGYN office. Okay, trends in nursing. One trend is the growing focus on nurses' mental health. It seems to have really taken off during COVID. The research shows that, especially post-pandemic, nurses are at risk for developing or worsening mental health conditions like PTSD and anxiety. Examples of stressors include the work environment, long shifts, heavy workloads, and workplace bullying. Since the pandemic, employers have had more of a focus on providing nursing staff with the training to care for themselves mentally. And I can only speak for Duke, but I know that Duke has required LMS trainings to provide staff with education and tools to protect their mental health. And then Duke also offers the free service of speaking with a therapist, and that's for students and for staff. And a second trend in nursing is the continuation of the nursing shortage. Some interesting statistics, for me at least, about a third of nurses are approaching retirement age, and baby boomers reaching retirement age will cause a 79% increase in older adults. So, losing a lot of nurses, gaining a lot of patients, not good. Other factors for the shortage include burnout, being dissatisfied with their salary, and more nurses leaving bedside and going to outpatient care or telehealth and working from home. So some nursing inventions. In 2023, a nurse named Veronica Pellegrino created a product called Popsy. It's a tool to open medication packaging quickly and also to reduce the repetitive motion of opening that product several times a day. And another invention was created by Abby Winterberg Hess. She works in pediatric PACU and identified the need of documentation for pediatric anesthesia and the need for an intervention for calming kids while they're getting anesthesia. So she created an app where it's a visualization of different zoo animals blowing up balloons. So the kid wears the mask that's administering the anesthesia, and as they're breathing that anesthesia in, the zoo animal is blowing up the balloon on the screen. The research shows that children who fall asleep calmly are shown to have better surgical outcomes, like less delirium, less pain, and less behavioral problems as the anesthesia wears off. And not only does the app obviously help the patient, but it also provides documentation. Like, it automatically documents into the system. Like, they, at her hospital, it's connected with Epic, but from my understanding is that it can connect with any documentation system. But anyways, it automatically documents the time it took, the amount of anesthesia administered, and the app actually has like different methods, so it can document which one was most effective for that child specifically. So pretty cool. It's been like spread across several hospitals at this point, and yeah, pretty cool. And finally, as nursing, future nurses, as future nurses, we can become innovators by observing patterns and discovering the needs for new products that our patients would benefit from. We can create a prototype and then work with engineers to make it happen. I know from my clinical experience, one of the hardest part is seeing the need for something or seeing my patients suffer and not being able to do anything at all. So I can imagine that it wouldn't be very hard to identify patient needs, and hopefully come up with something that can benefit them, even though, we can't write orders for medication and we can't control the surgical schedule. Maybe we can do something to at least ease anxiety